In this video, I'm going to show you how to use kinesiology tape as an adjunct to help your foot and ankle feel more comfortable doing everyday activities and even in sports. What I'm about to show you is one of Soleil's signature techniques created by the owner of this clinic, Ron Marcil. We've used this method so many times to help patients with ankle instability, plantar fasciitis, Achilles tendonitis, and metatarsalgia. Now that you know what kinesiology tape can do, let's get started on taping the ankle. So on this table we have two different color tapes, and the reason for that is because I want you guys to see where I'm putting the tape during the overlap. So I'm going to measure their foot, right? And I'm going to use this shoe as an example. Okay, so for your first two pieces of tape, what I want you to do is that I want you to measure from their midfoot, right, all the way up to where their heel is. Because when you go from their midfoot to their heel, you're going to be pulling at about 75% of a stretch for this, and then you're going to be attaching it to the Achilles, all right, or to the mid portion or top of the Achilles right here. For this person's foot, they're probably midfoot around right here, and then I'm just going to pull it up. It's about right here. So give or take, this is how long our shorter piece of tape is going to be. All right. Now, if you buy this brand of tape, you'll get to see the measurements right here, and you can cut accordingly. Okay, so I'm going to cut somewhere around here. If you cut it too short, right, like what I did initially, okay, it will be too short when you pull it at 75%. Okay, so this tape only goes up to about his heel right here, and it's not going to be enough to attach to the Achilles. So those of you who have like Achilles tendonitis issues, this piece of tape will not benefit you because it's not going to be long enough. So I'm going to do the same thing with this side. All right, so once you cut the first piece of tape, it's so easy just to cut the second one. You just kind of overlap it, and then you just cut. I like to round the edges as well because it's so easy for the tape to just peel off if the edges aren't round. So you can see here the edges are rounded. Third piece of tape and fourth piece of tape are going to be a little bit longer than this, just a tad bit. Okay, so from here, I like to just overlap it like this, and I might pull it out maybe 2 or 3 inches, and I eyeball it, right? Because you're going to go around the ankle during this part. Okay, so give or take, it's about a couple of inches longer. So now, by the end of this, you should have 2 pieces of tape that are short, right? And then 2 pieces of tape that are long. So I'm going to use my first piece of tape. And the first piece of tape, as I mentioned before, is going to go somewhere around the midfoot right here. If you have forefoot pain, right, or metatarsalgia, then it can be applied over on that part. So for this one, I'm going to rip open this anchor. Right, so this is our anchor point right here, and I'm just going to apply it right onto the mid to forefoot. I'm going to pin it down. I'm going to pull this tape downwards, right, about 100%, back it off a little bit, and then I'm just going to go under and cup his heel. Can you lift up your foot for me? Thank you. All the way up. Great. And then from there, so if my colleague has Achilles tendonitis, this is definitely going to help him because it's encompassing, right? It's over the Achilles right now. And as you're doing this, you don't want any wrinkles or anything like that. It just makes it uncomfortable for the patient. So make sure that everything is smooth. Our next piece of tape that we're going to use is this black tape, and it's going to go from one of the bones on the inside to the outside ankle bone. Right? They're called your malleoluses. So it's going to go from above the malleolus on the inside all the way around and underneath to the other side. All right, and I'm going to pull this anchor. And I get this. I'm going to pull it out just like that. It's going to go underneath. Great. So everything that you're seeing here is reflected on the other side. Okay? And so here's where things get a little bit complicated. And this is why it's helpful to have different color tapes. In this viewpoint, you'll be able to see me place the tape right here, and I'm going to go underneath. I'm going to go underneath in the front of the ankle bone, and I'm going to go underneath where the heel is, right? I'm going to come around, and I'm going to reattach it right here. So I start at the top over there, right? And then I went underneath. Go ahead, lift this up, right? I went underneath here, and I went around, and then put it down, forward, and then it came around just like that. On this side, and we're going to repeat the same steps. For my colleague's foot, I cut this tape a little bit too long, okay? Because if I did it correctly, it should end up right around here, right? You go around, make sure that there's no wrinkles, and if there are, that's fine. Just kind of straighten it out. Now that you know how to tape the ankle, let's look at some common questions that we had come across over the years. How long should I leave it on for? We recommend anywhere from 1 to 3 days. Can you shower with it? Yes, you can, but make sure you dry it down by gently patting it down with a towel. Are there any potential side effects? Yes, some people have experienced some skin irritation after sports, sweating, or showering. If this happens, just remove it and do not reapply again. You can also try a different brand if you like, but like I said before, it's supposed to be used as an adjunct to your physical therapy exercises. Now that you have the skills, practice it and let us know if this works for you. Thank you.